देखिए चेक कर लीजिएगा, थोड़ी 10 मिनट बाद एक बार चेक कर लीजिएगा स्क्रीन में। Hi, good morning. Hi, good morning. Sorry for the delay, but without wasting time, let's start our lecture. Okay, so today's lecture will be on primary healthcare. Here, Dr. Inakshi has already been discussing about primary healthcare, and then so I'll cover up a little bit portion of primary healthcare. The healthcare, what it is defined as the multiple services rendered to individual, families, or communities by agents of health services or professionals for the purpose of promoting, maintaining, monitoring, or restoring health. Okay, so I'll repeat what is the definition of healthcare. First, healthcare. You should, before primary healthcare, you should understand what is healthcare. Okay, healthcare is defined as multiple services rendered to individuals, families, or communities by agents of health services or professionals for the purpose of promoting, maintaining, monitoring, and restoring health. So, what do health professionals do? They promote, maintain, monitor, and restore health. There are levels of healthcare. So, the healthcare is distributed on at primary level healthcare, secondary level healthcare, and tertiary level healthcare. So there is a primary, secondary, and tertiary levels of healthcare. Primary healthcare. This is a first level of contact between a recipient of care and the healthcare delivery system. Majority of the problems at this level are solved by the people with some assistance and guidance of health workers. So this is the first level of contact between the recipient of care and the healthcare delivery system. Recipient of care means patient, and healthcare delivery system is hospital or primary healthcare centers or uh, any healthcare facility which is providing healthcare services to the population. Majority of the problems at this level are solved by people with some assistance and guidance of health workers. In rural area, these services are given by the means of sub-centers, primary health centers, and community health centers. So there are in the rural areas there are some centers created by the government to provide health care to the services. Those are sub centers, primary health centers, and uh, community health centers. In urban areas, these services are given by maternal child health and family welfare centers. In urban areas, these services are given by maternal child health and family healthcare centers and dispensaries. At secondary level healthcare, at this level, more complex problems are taken care mostly which requires secondary level of preventive services and curative services. These services are provided at the district health centers, hospitals, and those cases which cannot be handled by PHC or CHC are referred to the district health centers. A tertiary level healthcare. This level of healthcare is provided at a state, regional, central level institutions. These institutions serve as referral units for primary and secondary levels. They also serve as a teaching institution for education and training of various categories of healthcare professionals. So it's just like medical institutions close by to the rural areas. So these are medical institutions and all which provide these services. Now, primary health care. So, primary health care is essential health care and technology based on practical, scientific, practical, scientifically sound, and social acceptable methods and technology made universally accessible to individuals and families in the community by means of by means acceptable to them through their full participation and at the cost that the community and country can afford. So primary health care is a definition of the health care which can be provided, which is provided to the grassroots level people from the government or in liaison with the private institutions with full participation of the people and at the cost which a community or a country can bear. Okay. But you can write down this the whole definition here. I'll repeat again. Primary healthcare is essential healthcare and technology based on uh, on practical, scientifically sound, and social acceptable methods and technology made universally acceptable to individuals and families in the community by means acceptable to them through their full participation and at the cost that the community and country can afford. The concept of this primary healthcare is the concept of primary healthcare was introduced at international level jointly by WHO, that is World Health Organization, and UNICEF at the Alma Ata Conference in 1978 to achieve the goals of uh, health for all. HFA means health for all by year 2018. Now, coming to the principles of primary health care are it should be equally distributed, like equitable distribution, coverage and accessibility, community participation, multi-sectoral approach, appropriate health technologies, human resource, services by community health workers, referral systems, logistics of supply, the physical the physical facilities, control and evaluation. Okay. So I'll just repeat the principles again because it's in one time it's not difficult. It's very difficult to remember everything. It's always good if you guys can write it down. So the principles are equitable distribution, coverage and accessibility, community participation. Is it should be equally distributed. Coverage and accessibility. Coverage should be maximum, and accessibility for the health centers should be on priority and should be taken care of. There should be community participation. Community participation means the people in the villages or the heads of the villages should participate in the delivery of healthcare system. Like for example, they bring the patients to the center can also go and have conduct some meetings about the preventive health services and everything. So community participation. Yeah. Then multi-sectoral approach. Multi-sectoral approach means health, the government sectors, the municipality, the gram panchayat, healthcare workers, institution. So all should come at the one. All come in liaison for delivering the health services and keeping the community and the people of the community healthy. Okay, so it is a multi-sectoral approach. Now, appropriate health technologies. So, appropriate health technologies means there should be sufficient investigation equipment and everything related to the technology. Human resource, there should be specific, there should be minimum human resource which should be available. Then services by community health workers, referral systems, logistics of supply, the physical facilities, and control and evaluation. Coming to equitable distribution, it means primary healthcare services must be shared equally by all the people. Coverage and accessibility. The primary healthcare aims to provide healthcare to all the population living in any geographical area. That includes the hilly areas, tribal people, and other not able to reach population. Community participation is the process by which individuals and families assume responsibilities for their own health and welfare and for those of the community and develops the capacity to contribute to their uh, country's development. Multi-sectoral approach for achieving the goals, coordination with the other sectors is necessary because no sector can achieve its goals in isolation. Appropriate health technologies, it implies the use of methods and techniques and equipments which are scientifically sound but simple. Human resource for the effective implementation of primary health care, it is essential to make full use of all the available resources, including the human potential for all the countries. So human resources are without human resources nothing can move, right? Uh, Services by community health workers. The community health workers from a link between the community people and health system. They are given a short and simple training to be able to take care of the simple and basic health needs for the people. Referral systems, the patient with severe conditions unable to tear at, at the primary level should be referred to the higher or specialized centers for the proper treatment. And logistics of supply, it includes planning and budgeting of the supplies required, procurement or manufacture, storage, distribution, and control. Elements of primary healthcare are education to the people concerning prevailing health problems and methods of preventing and controlling them, promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health care, and family planning, immunization against the major infectious diseases, prevention and control of logically locally endemic diseases, appropriate treatment. of common diseases and injury, and provision of essential drugs. Okay. So this ends with today's lecture. Yeah, we have some more time, so we will go to the next topic. We'll start. Okay, we will take another topic. Just a minute. Give me 1 minute to figure out. Okay. So healthcare delivery system in India. So it is a successive topic again. As as is well known that the majority of the Indian population live in the rural area, and this segment of the population have been given inadequate attention so far as the health and medical care facilities are concerned. The dense rural population with varied ethnic background, high level of illiteracy, and low per capita income have been challenged to central and state government to improve the quality of people's life. To cope up with various programs were developed aiming to improve the level of living and health of the people. This planned development of above 5 decades has resulted in increase in the health infrastructure to meet the increasing demand of health services at various levels. At the time, at the same time, there has been a marked shift in national health policy from hospital-based services to community-based services due to backed of strong referral services. Today, it is clear that health system in India do not gravitate naturally towards the goal of health for all through primary health care as articulated in Declaration of Alma-Ata. Health system in India in India are developing in directions that contribute little to equity and social justice and fail to get best outcomes for the resources. There are three worrisome trends of healthcare system in India. Now, what are they? Health system that disproportionately focus on narrow offer of specialized healthcare. The health system that disproportionately focus on narrow offer of specialized healthcare. The health system where a command and control approach focused on short-term results and is fragmenting the service delivery. And the healthcare system and the healthcare system where governance has allowed unregulated commercialization of the health or health to flourish. Just a minute. Now, coming to shortcomings of healthcare delivery systems in India, inverse care, em- impoverizing care, fragmented and fragmenting care. Just a minute. Fragmented and fragmenting care, and unsafe care, and misdirected care. You can use any word to describe the failures of the system, but sorry, my throat is. So, people with most means whose need for healthcare are often less consumed, and the most healthcare service. So, people with most means whose needs for healthcare is often less, which is consumed most healthcare services, whereas those with the least means and greatest health problems consume least. So, public spending on the healthcare services most often benefits the rich more and than the poor. We are trying to say that the healthcare services are not uniformly distributed. The healthcare services are not reaching the poor. The healthcare services needs to be strengthened at the village level, and so improvising healthcare. Whatever people are lack, whatever people are lack of social protection and payment of healthcare, they are largely out of pocket at the point of healthcare services. They can they can be confronted with catastrophic expenses. Millions of the people fall in poverty because they have to pay for the healthcare services. Fragmented and fragmenting care. The excessive specialization of healthcare providers and a narrow focus on many disease control programs discourage the holistic approach to the individuals and the families. I repeat again, the excessive specialization of the healthcare providers and a narrow focus on many disease control programs discourage the holistic approach of the individuals in the family. The healthcare services for the poor and marginalized groups are highly fragmented and severely under resourced. The poor system design that is unable to ensure safety and hygiene standards leads to high rates of hospital acquired infection. Medication error and other unavoidable adverse effects are underestimated cause of death and ill health. resource allocation clusters around curative services and great cost, and it is neglecting the potential of primary prevention and health promotion to prevent up to 70% of the disease burden in the developing countries. Health sector lacks to mitigate the adverse effect of health from other sectors, and at the same time unable to make most of what these sectors can contribute to the health. The organization setup of healthcare delivery system in India is the health development the health development is an integral part of overall socio-economic development. Ministry of Health and Family Welfare plays a vital role in planning and making policies. The under the under the Constitution of India, the item like public health, sanitation, hospital and dispensaries fall in the state list. Healthcare is the subject of state government, and each state in India has developed its own system of healthcare delivery independent of central government. The central organization is main. The central organization is mainly for policy making and planning, and is most uh, consultative and advisory. The organization and center comprise of Union Ministry of Health and Family Welfare, General of Health Services, Central Council of Health and Family Welfare, and the Ministry of Health and Family Welfare is headed by a cabinet minister, a minister of state. Currently, it consists of four departments: Department of Health and Family Welfare, Department of Ayush, Department of Health Research, and Department of AIDS Control. The Union Ministry formulate, formulates national policies on health and gives advices to health allied matters. It coordinates health programs and policies and supplies technical information and equipment. It provides financial and other assistance towards health measures. In general, it promotes the health and well-being of the people. The state is an ultimate authority responsible for all the health services operating within its jurisdiction. The present At present, there are 28 states and 9 union territories in India, as and as many types of health administration. In all the states, it comprises of state ministry of health and family welfare, General of Health Services. Right. So the State Ministry of Health and Family Welfare is headed by Minister of Health and Family Welfare, a Deputy Minister of Health and Family Welfare. The Secretariat is an official organ. It's an official organ, and it comprises of Health Secretary, Joint Secretaries, Deputy Secretaries, and Under Secretaries. The Director General of Health Services is a technical advisor to the state government in all matters of medical and public health. DGHS is assisted by 2 to 3 joint directors, and the joint directors may be of regional and functional level. The regional directors are the divisional level and area classified according to the geographical distribution. The functional directors are the particular branch of public health, such as maternal and child health, family planning, nutrition, and health education. To coordinate the health and family welfare activities between state government and central government, there are 17 regional head offices. For the large state, there is one regional office, while two to three smaller states have been linked with one regional office. The district level structure of health services is a linkage between state structure on one side and the peripheral structure such as CHC, PHC and subcenter on the other side. The district officer of overall control designated as CMHO. CMHO are assisted by deputies, program officers, and state civil medical officers of different specialties. They are responsible for implementing health and family welfare programs according to the policies laid down by the higher levels. So we'll stop here. At the block level, we will discuss in our next class. So I'll stop here at the block level, and from the block level we'll discuss later.